Hi, my name is Dr. Jeffrey Lawler. I'm an orthopedic surgeon, sports medicine specialist here in Anniston, Oxford, Alabama. I'm a partner at Core Orthopedic and Sports Medicine. I grew up in Massachusetts, where I did my undergraduate training at Brown University and my medical school training in Albany, New York. I joined practice out here in 2012 and have been here since. I'm married, I have 4 small kids here in the community. I enjoy the outdoors. I like to hunt, I like to fish, I coach football, baseball, and then travel around with my daughters doing gymnastics. One question I'm asked often in the clinic is, how do you approach a patient who has multiple joint problems, who may need multiple joint replacements? To me, it's fairly simple. It's really a quality of life issue. I usually will focus mainly on the one that's limiting their activities on a day-to-day basis. If they're equal, I will really try a course of conservative management, whether that be with medicines, injections. I think physical therapy plays an active role in these patients to really see if we could help their joints to where we can focus on just maybe one knee or one shoulder or hip. Typically, I will start with the joint that's giving the patient the most problems and then address the other one in a staged fashion. I'll typically give my patients anywhere between 6 to 8 weeks and up to 3 months before I move on to the second joint. These are very complicated patients. Rehab is often limited, secondary to their other joint pains, and I think it's imperative that we address those pains to help with the rehab of their total joint replacement. Yeah, in my clinic, we typically see what we call osteoarthritis, or what people consider as wear and tear arthritis. However, if I see a younger patient who has multiple joint abnormalities, diffuse pains, one needs to consider more of a global autoimmune disease, such as a rheumatoid arthritis or lupus or psoriatic arthritis. We'll typically refer our patients to rheumatology for further evaluation to see if there is a more systemic treatment before moving on with joint replacements. Some of it is genetics, and there's not a lot we can do about it, but there is some things such as exercise, such as weight loss. We know that the knees see upwards of 6 times body weight in regards to knee stresses. So I will typically encourage my patients to be on a good, healthy diet, exercise regularly, and focus on weight loss. The last thing you want them to do is to become immobile. Their joints will become stiff, and they become very deconditioned even prior to surgery. Now, following their surgery, we're very aggressive. We're making our patients get up with therapy the day of surgery. They're walking the day of surgery. It's imperative that we get them into therapy as an outpatient right away to maximize their outcome in regards to their joint replacement surgery. Just because you have a joint replacement doesn't mean that we still need to focus on diet, exercise, moving forward to allow that joint to last over the course of their lifetime. If you'd like to contact my office, my information will be listed on rmccares.org.